Beep, 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 beep. We interrupt this cartoon to bring you a nuclear attack emergency PSA. What would you do in the event of a nuclear attack? Would you be like poor Billy in the small town of Macon, Georgia? Dear sweet Billy died from ARS. What is ARS, you might ask? Well, that's what we're here to show you. ARS stands for Acute Radiation Syndrome. Acute radiation syndrome is when your body is hit with a lot of radiation in a short period of time. Low exposure of acute radiation results in bone marrow destruction, nausea, and a fever. It is possible to recover in a few weeks. High exposure of acute radiation causes the cardiovascular and central nervous system to collapse. This causes comas, convulsions, and death within days. Medium exposure can kill some patients from internal bleeding and infections. Death within 2 months is expected. Severe cases of medium exposure can lead to death within weeks. This can be caused by radon gas accumulating in the basements of buildings when people are hiding from a nuclear explosion. The effects of this case of ARS ranges from serious ailments such as bone necrosis, bone marrow destruction, sterility, lung cancer, DNA damage which can lead to birth defects, hair loss, and burns in skin.
There are many different layers to nuclear radiation in a nuclear bomb attack. The fireball radius is the centermost circle of radiation. This area is where the bomb actually lands. If a person were to be in the fireball radius, that person would be immediately vaporized. The air blast radius is the second circle of radiation in a nuclear bomb attack. Buildings are destroyed and there are many fatalities in the air blast radius. The thermal radiation radius is the third circle of radiation. In the thermal radiation radius, third-degree burns occur in several layers of the skin. There is no pain because the nuclear radiation has destroyed pain receptors. Overall, based on the wind patterns, radiation fallout could cause many severe effects. Based on how close a person is to the actual nuclear bomb, fallout could kill, cause serious radiation poisoning, or acute radiation sickness.
Now that you know what nuclear radiation is and what it does to the human body, let's learn more about how to protect against nuclear radiation. If you are in a classroom, duck under desks and shield your head with arms. There is no guarantee that this will help you survive said attack. So be sure that you wear a dog tag to school every single day so that we can identify you in the nuclear waste rubble when you are found. If you are outside, seek shelter. Do not stay in your car if you are in one. Remove outermost layer of clothing. Cover nose and mouth with a wet rag if you have one. If you are at your house, go into basement. Turn off AC to prevent nuclear radiation particles from entering house. Refrain from drinking water from not sealed containers. This concludes our nuclear attack PSA. Remember, stay safe, stay smart, and be aware.